These residents wave goodbye to yet another neighbor who's died of COVID-19, a scene that's being repeated at what medical experts call a catastrophic rate. Hector Herrera's 47-year-old brother was infected while at work in a pharmacy. 3 days after taking a COVID-19 test, he was rushed to hospital, but he was sent back home the next day without a diagnosis. 2 days later, he was back, unable to breathe.
He was worried that we could get infected, and he sent us home. The next day he was dead. We buried him. And it wasn't until the day after that that the results of his COVID test came back positive.
Hector and his family blame the government for gross incompetence. They're angry that it refused to implement drastic measures early enough to prevent widespread contagion. The government was reluctant to declare a full lockdown in the capital until a month ago. By then, contagion was totally out of control. And even that has been ineffective. Government subsidies have been insufficient and too slow in arriving. As for respecting the quarantine, we crossed the whole city without being asked for our permits to circulate by soldiers or police.
We're in Puente Alto, the community with the highest rate of contagion in the whole country, and it's supposed to be under lockdown like the rest of the capital. But as you can see, there are people absolutely everywhere, traffic as well. And so now more and more voices are demanding that Santiago be put under hibernation, which is really just a euphemism for a quarantine that actually works.
We spoke to the think tank that came up with the term.
At the beginning, we had a 40% reduction in public mobility, but this is way too little. We need at least 70% for a lockdown to be effective, and now many people are ignoring it altogether. So we need to rethink the strategy.
That means enforcing the quarantine energetically, allowing only essential businesses to keep working, and implementing a robust social aid program to allow the unemployed to stay home, something the president has finally agreed to do. Many accuse the government of refusing to listen to warnings from mayors and the scientific community.
I think that is the main core of the problem in Chile. Like a government that was not able to hear on time, was not didn't want to make the right choices on time, and now we are suffering the consequences on that.
As of this week, there's a new health minister who's more open to advice and criticism. But promises of remedying past mistakes is small consolation for thousands of families who are burying their dead. Lucia, Newman, Jazeera, Santiago.